We are excited today to have two of the leaders in this credentialing and privileging issue, Dr. Karen Ruban and Jeannie Miller from CMS, join us today as guest lecturers for today's Brown Bag Telehealth Seminar. Dr. Ruban and Ms. Miller will give us the latest update on a recently proposed CMS regulation on credentialing and privileging telehealth providers, and a little background on how we got to this point. Dr. Ruban, as you can see from the information, is a professor of pediatrics and the associate dean and the director of the Office of Telemedicine at the University of Virginia. She is a pediatric cardiologist, a fellow of the American College of Cardiology and the American Academy of Pediatrics. She's the president of the Virginia Telehealth Network. She is also the immediate past president of the American Telemedicine Association and a board member of our organization, CTeL. So I kind of wonder when she has any free time beyond all of her responsibilities here. Ms. Jeannie Miller is Deputy Director of the Clinical Standards Group in the Office of Clinical Standards and Quality at the Centers for Medicare and Medicaid Services. She is responsible for oversight of the regulation and development and policy interpretation for hospitals, critical access hospitals, organ procurement organizations, transplant centers, and long-term care facilities. She has been the program administrator in her previous life, specializing in hospital oversight at the West Virginia State Survey Agency, and she has served as a hospital nurse for over 20 years. What we decided to do in this presentation is I'm going to give a little background on the current situation that I'm sure most everybody in the telehealth community is well aware of, but we thought it might be of some value to make sure that everybody was at the same basic starting point for this discussion. Let me take a moment and digress just a bit to talk about CTeL's involvement as a resource organization in the National Telehealth Resource Center, serving as a resource and technical assistance in information as this process unfolded. In 2008, the Center for Telehealth and eHealth Law Board of Directors received some information both from some of the accrediting body organizations as well as hospitals, and asked for and called for an immediate emergency board meeting. We went into that board meeting, had a lot of discussion about the impact of what was coming down the road on credentialing and privileging for telehealth physicians. No offense intended, Jeannie, but the word was we went into DEFCON 5 and immediately tried to get information out and tried to get to the point where we are today. This rule is open to comment, which we will hear about soon. We'll be getting comments from individuals, and it hopefully can be tweaked as it goes along. But as an individual who has worked on Capitol Hill, worked in the executive branch, and been around government for probably better than 30 years, I can't tell you the number of times I've heard people say, well, it doesn't do any good to contact your senator or congressman, or it doesn't do any good to contact policymakers in Washington because those people know what they are going to do and they're going to do it regardless and they don't care what anybody has to say. Well, I think if at all, that notion should be dispelled because where we were in 2008 on this issue and where we are today is light years apart, and it's due in large part to the open lines of communication that many people in the telehealth community had with members of Congress, with other officials within the federal government, and quite frankly, the open door and level of open communication that has developed with CMS on this issue. So as a point of just my own personal comment and observation, and not in an advocacy role in any way, shape, or form, but to tell you that policymakers in Washington do listen, and this is a perfect example of that happening. So with that comment, what I'd like to do is briefly talk about the procedures that are in place as of right now, and then we will go to our two speakers. As you know, the current CMS conditions of participation on telemedicine services, in a nutshell, require hospitals receiving services to privilege each practitioner as if on site. Breaking that down a step further, what that means for hospitals, a hospital's governing body, to meet the CMS conditions of participation, must make all privileging decisions. And let me digress 1 second here. If either Dr. Ruban or Jeannie have anything you want to add in here as I go along, please feel free to jump in. In the making of that hospital governing bodies making those privileging decisions, there are 3 things to keep in mind. First of all, they must thoroughly examine and verify the credentialing of those physicians and practitioners. Second of all, hospitals may use credentialing verification resources to get to that point. And third, the hospitals must use specific criteria developed within those hospitals to make those privileging decisions. Now, with regard to critical access hospitals, which is another important aspect of this credentialing and privileging issue, if the hospital is a member of a rural health network, they must have an agreement for the review of privileges for that hospital, for that critical access hospital. That agreement can be with either another network member, a Medicare Quality Improvement Organization, or another qualified entity in the state's rural health plan. This brings us to the procedures, and those were the CMS conditions of participation guidelines that brought us to 2004. And I'm going to briefly cover 2004 and the Joint Commission guidelines, and I know that Dr. Ruban has a lot more that she's going to be adding to this. But working with the telehealth community, the Joint Commission developed telemedicine standards that had been in place since 2004. And most of you are well aware of those telehealth standards, but in short and in simplified version, they allowed for credentialing and privileging by proxy between Joint Commission accredited facilities. Now, as Jeannie, I'm sure, will explain when she gets, if this is part of her presentation, the Joint Commission guidelines on telemedicine standards were not considered to be in compliance with the CMS conditions of participation. And in 2008, Congress passed the Medicare Improvements for Patients and Providers Act, better known as MIPA. And in MIPA, the deeming authority, the permanent deeming authority that the Joint Commission held up until that passage of that legislation was in fact modified and changed in MIPA so that the Joint Commission had to reapply to CMS for a continuation of their deeming authority. During that application process to come into compliance with, to bring the Joint Commission guidelines across the board into compliance with CMS conditions of participation, one of the issues on the table that was in discussion between the two entities was in fact the telemedicine standards. And in CMS's granting of the Joint Commission's deeming authority to continue on, the Joint Commission had to agree to come into compliance, or came into compliance, with the CMS conditions of participation. And that would have been effective July 15th of 2010, next month. So the Joint Commission was statutorily required to enforce the CMS conditions on participation. At this point, I'd like to turn it over to Dr. Ruban, because I know she would like to talk about the history of how the Joint Commission fit together with the application of telemedicine and the conversations and developments that led us to the rule that's being proposed. Dr. Ruban?
Thank you, Greg, and thanks everybody for joining in. This has clearly been a collaborative effort amongst the telemedicine community and CMS, and we are very, very grateful for where we have moved. I'd like to even flash back to 2000 when the Joint Commission standards were totally in alignment, well, pretty much in alignment with the CMS conditions of participation, but Dr. Bob Wise, who is Vice President for Standards, came to CTeL to present this, and when he heard from the telemedicine community about our concerns, he convened a task force, and actually the Joint Commission then moved forward with those standards that you referenced. And those standards required that the medical staff of the consult origination hospital or facility would have an agreement with the distance site, and also the quality measures would be evaluated. And again, we were very, very grateful for the change in those standards. Now, since MIPA, a number of us have reached out to our legislators, and I wanted to personally thank Congressman Rick Boucher and Congressman Thompson. Congressman Boucher from Virginia, Congressman Thompson from California, and Senator Udall from New Mexico, who all tried to reach out, but we actually met a bit of a logjam. But we are really, truly thrilled that with the appointment of Ms. Marilyn Tabner as the Principal Deputy Administrator at CMS in, I guess it was February of this year, and her also appointment as Acting Administrator, she was very receptive to directing her staff to work with the telemedicine community. And it was a real privilege for CTeL, American Telemedicine Association, University of Virginia, to host Dr. Barry Straub, who's the medical director at CMS, and Jeannie, as well as our colleagues at UC Davis and representatives from Critical Access Hospital, to have an open and frank discussion about the challenge. So we did have that meeting in early April, and from what I have been advised, quite frankly, it has been nothing short of miraculous at how quickly CMS has responded to the needs of the telemedicine community, recognizing the challenges that we face with the July 15th deadline looming. What's important for everybody to know was that, of course, these conditions of participation affected pretty much all of telemedicine. It didn't just affect Medicare beneficiaries, but anyone who receives services through a hospital, receive telemedicine services through a hospital, would be impacted by this rule. And so, again, the multiplier effect of the July 15th requirements were just absolutely tremendous. And we truly felt that health care in rural communities in particular would be adversely affected by a change in the rule, and that was really part of the genesis of CMS's rapid determination of this proposed rule, and also their letter to the Joint Commission. So, Greg, you would want to go on to the next slide?
Yep.
Okay. So, in the Federal Register, and I know Jeannie will speak to this, the proposed rule has been published. It was in late May, which is a proposed rule for revising the conditions of participation for hospitals and critical access hospitals. And equally importantly, they sent a letter to the Joint Commission to extend the July 15th deadline for the Joint Commission standards. And those have been extended to March 1st, 2011, while CMS is deliberating the comments and moving towards a final rule. So that is a huge relief to all of us nationwide who provide telemedicine services. It was a very burdensome and duplicative process that we were facing, and quite frankly, I would say a significant number of telemedicine providers would have been forced to abandon their telemedicine programs because of the undue burden of time and cost on these credentialing and privileging decisions. For privileging, credentialing is certainly a challenge. Privileging is equally a challenge for hospitals. And one of our identified issues was that many of our partner facilities, consult origination sites, don't even have the ability to review the credentials and privileges because they themselves don't have those specialists on their staff. Privileging and reprivileging, which occurs every 2 years, is a very involved process, and it requires evaluation of quality measures, and there was really virtually no way that this could be done at the consult origination sites for clinicians, especially highly specialized clinicians who are located at the distant site. So again, we are very, very grateful to CMS for moving this forward, and I am really thrilled to have Jeannie here with us to discuss the proposed rule.